Bad news. Biden has COVID. Good news. He's in a much better situation than Trump was. I'm Tyrone Bowman. This is Tyrone Bowman Tonight. According to an article written in USA Today magazine by Austin Bogles and Steve Porter, I quote, "The White House announced Thursday that President Joe Biden has tested positive for COVID-19 and is experiencing very mild symptoms, marking the second time a sitting president has come down with the virus. A lot has happened since President Donald Trump was briefly hospitalized with the coronavirus in October 2020. To make sense of how Biden's situation compares with that of his predecessor, USA Today caught up with someone who has firsthand experience dealing with a commander-in-chief with COVID-19, and that someone is Dr. Jerome Adams. According to USA Today, he talked about Biden getting COVID, and Dr. Jerome Adams talked with USA Today opinion about President Biden getting COVID and where the pandemic is overall. Dr. Jerome Adams, a USA Today Board of Contributors member who was U.S. Surgeon General when Trump contracted the virus, offered his perspective on what Biden's diagnosis means and what we should expect moving forward. His interview with Editorial board members Austin Bogles and Stephen Porter has been lightly edited for length and clarity. Biden is vaccinated and double boosted. How surprising is that he caught COVID? It is not a surprise that he got COVID, to be frank. What's more of a surprise is that he's been able to go this long before getting COVID. We know that particularly against new variants, protection against the spread of COVID for those who have been vaccinated is quite low. Really, you're getting vaccinated now to protect yourself against severe disease, against hospitalization, and also against the development of long COVID. Am I a schmuck? I got COVID again. I'm staying home again. Others seem less cautious. There are other measures you can take to protect yourself against getting COVID, namely wearing masks. And we know that the White House has gotten a lot more liberal, if you will, in terms of who's allowed to be around the president unmasked. He's been on many trips. He's been shaking hands and fist bumping with other folks and people in crowds. So it's not a surprise that he got it. But it is a blessing from my standpoint as a citizen who wants the best for our leaders, and that he is double vaccinated and double boosted and is on Paxlovid. Biden is 79. How concerning is his age given his diagnosis? We know age is a significant risk factor. We also know the president has other risk factors. He's got atrial fibrillation. He's on a number of different medications. And so those are exactly the folks who we want to take the most precautions. That's why it's critical that those folks in particular are up to date on their vaccinations, fully vaccinated, plus have gotten boosters as recommended by the Centers for Disease Control and Prevention. Treating HIV taught us about inclusive care. Now, monkeypox is testing what we learned. So while we're very concerned about his age, we're assured by the fact that he has taken all the possible precautions and he's taking a medication, Paxlovid, that has been shown to decrease your chance of hospitalization. And that's what we tell people. Get your vaccine, get your booster. If you get symptoms, get tested properly so that you can very quickly be put on a medication which will allow your chance of lower your chance of hospitalization. So this is the interview that Dr. Adams conducted with the editorial board of USA Today magazine. What's the difference between Biden's diagnosis and Trump's? We are in a very different place now with President Biden than we were with President Trump. When he had COVID diagnosis, remember, we didn't have vaccines available when President Trump and the First Lady at that time, Melania Trump, were diagnosed with COVID. We also didn't have Paxlovid. So we now have a president who is vaccinated, who's received 2 booster shots. New studies came out showing that second boosters really does significantly lower your chances of having a severe course of disease. And again, we have the antiviral Paxlovid So Biden is in a very different situation. Remember, President Trump actually developed pneumonia. He had to be admitted to Walter Reed Hospital and had a very severe course. It remains to be seen what's going to happen with President Biden, but he's in a much better situation based on all data we have available to come out of this with to little to no harm in the long run. Is this White House being transparent? What questions should we ask in the days ahead? One of the things I want to clarify to folks is that it is challenging to get information because you do want to respect an individual's medical privacy, even if it is the President of the United States. So, there's that fine line between HIPAA, what should be protected information for an individual, versus what America deserves to know about their leaders' health status. And I'll end it here. I would frequently be asked about President Trump's medical diagnosis. While I work closely with the White House medical unit in several ways, I wasn't getting a blow-by-blow on the president's status because I'm not the president's doctor. What I think we should be asking is who the president was exposed to. That is critical in information so that we can protect other people. If you would like to read the entire editorial interview with Dr. Jerome Adams, simply go to usatoday.com. It's there in full. I'm Tyrone Bowman. Never surrender, never quit.